I don't expect to be an old, frail lady. I do expect to die sooner than most people would expect to die. In all likelihood, ADPKD will kill me, unless I get hit by a London bus.
ADPKD is the most common inherited disease that affects patients with kidney problems. The disease develops really as little cysts from which the disease derives its name. And cysts are really little blisters that arise from the kidney substance. As the cysts enlarge, the kidneys enlarge, and patients become symptomatic with pain, passing blood, or having infections. Eventually, the kidneys become destroyed, leading to the need for dialysis or a transplant, usually by the age of 55 years.
I feel very tired. That's the most sort of bad symptom. I'm very anemic. My kidneys being very large, they hurt, so you live with constant pain.
My kidneys are getting bigger and I have started to notice them. I worry about the shape of my body. I've always prided myself on being slim and fit, and ADPKD causes kidneys to grow hugely in size. I have to go frequently to the hospital to have blood taken. I sit around hospital waiting rooms, I have done all my life, waiting to be seen by doctors.
In my professional life, the difficult thing was that I felt I had to hide the disease. I was afraid, in fact, of not progressing at work if I didn't hide the disease, and I was also afraid of being labeled as somebody having a genetic disease.
Before I had ADPKD, my wife and I would be dancing 6 nights a week. But now it's a case of walking through the door and getting changed, sitting down with my children and falling asleep. The children are very boisterous in the house. I mean, it's a 3-year-old and a 5-year-old. They're brand new, they've got loads of energy, you know? And you can't cope, you physically cannot cope. So you have to sit down and just smile because you know, you want to be out there, you want to be, you know, tumbling and doing all the things which boys do. But you physically haven't got the energy, you know?
ADPKD is an ever-present feature of my life and the lives of my family. I had an older sister who inherited ADPKD. She died last year of complications from the disease.
I'm one of 6 children, and out of the 6 children, 4 of us have inherited the ADPKD.
ADPKD has really affected my family. My father died on dialysis at 50, and the relationships with my mother have always been difficult when it came to talk about the disease.
I knew nothing at all about ADPKD before I was diagnosed with the condition. The emotions were really bad because I've always kept physically fit, always eaten well. So I was devastated in a way to be told that I got polycystic kidney disease. The worst people to tell was my mum and dad because they just lost their son last year. my brother Anthony, I just told him straight, you know, you can't put it nicely to anybody or softly to anyone. It's a brutal fact.
What I fear the most is to see my daughter going on dialysis one day. Dialysis represents death for me in a way because my father died on dialysis, and this is obviously a fear that everybody who has PKD has.
ADPKD is like living on a knife edge, on the edge of a precipice. You're walking towards it, and one day you know you will fall down it. It's always at the back of your head, something that you wake up in the middle of the night and think about occasionally, sometimes that you cry about occasionally. Yeah.
How do I tackle transplant and dialysis? Like I said to Louise, my wife, I can't run away from it, so I've got to do it, you know? It's my path in life, okay? Even though I'm petrified of needles. But it's what life throws at you, so...
6 weeks ago, I had a kidney transplant. The operation took about 4 hours, and apparently the minute they connected the kidney to the blood vessels, it started to work. But the symptoms that I'd had with the kidney failure, some of them are still there. But I was elated. I couldn't stop smiling, I suppose. I didn't feel any younger, but I just couldn't stop smiling. I had colour in my cheeks for the first time in a long time. I feel I've had a very positive attitude of, yes, I've got the disease, but it's not going to beat me.
I guess what the disease has told me is that we must absolutely enjoy life to the full, and every moment in life is important.
When people hear about kidney disease and polycystic kidney disease, and they hear that you might have to have dialysis or transplant, they think that's a cure. Lots of people think that dialysis or transplant is a cure. Have a new kidney? That's fine. End of story. Of course, with ADPKD, it continues. ADPKD is incurable, it's a silent killer, and too few people know about ADPKD and understand and appreciate the impact it has on the individuals affected and their families.